12:04 in the afternoon here on 90.3 FM. It's Wednesday. That means it's Joe Steckler Day, helping seniors of Brevard. And here is your host for Helping Seniors of Brevard, Joe Steckler. Hi, Joe.
Hi, John, and welcome to this edition of Helping Seniors. Helping Seniors was designed and founded in order to inform, educate, and connect seniors and those that care for seniors with the many wonderful resources we have in Brevard County. I've been involved in this work well over 30 years now, and it never ceases to amaze me that having been in it this long, I can find out new things myself all the time when I talk to our home care people, when I talk to our insurance people, when I talk to anybody connected with the healthcare industry. There is just so darn much to know about it, and when you're involved in the healthcare system and yourself, and you're trying to find doctors, you're trying to find ways to alleviate pain, and you go through all this stuff yourself, and you still talk and write about it, it gives you a whole different perspective on people that stay at home with ungodly pain, and they just don't know what to do with it, don't know how to handle it, and they don't know who to go to for help. And that's a sad commentary on the medical system that we have in place in the United States. And when you have to wait 3 or 4 months for an appointment, we talk and we say, well, social care system, you just don't get stuff. You have to wait and wait and wait. We do the same thing in this country. We wait, we wait. But having said that, we still have pretty darn good care in this country. So my two panelists this morning are Traci Graf from Avid Home Care and Debbie Fischer from Medi-Health Insurance. Medi-Health Insurance. I want to say she stuck her finger on health, so I would point out, you see, this is not TV. You can't see what my panelists do. I can tell you what they do, though, when they try to distract me. But the thing is, Debbie and Traci, if we do a radio show, we want to have fun doing it. We want to have fun doing it for a number of reasons. I have always believed that a radio show can do with some of the serious topics that we get into today that Amos and Andy used to do 60, 70 years ago, when they would make people laugh, or you would hear the Shadow on Saturday, and you would listen to Batman and Roger and listen to all this stuff. And when you think about radio informs you. Those old radio shows informed you about certain things that you couldn't see it. They try to draw a picture for you. So we do the same thing with radio today. And that's why we have radio for our organization. That's why we have television, because there are certain things that fit both. And having said that, I'd like to welcome both of you this morning to the show. And let's talk first. I want to talk about what Traci does with Avid Home Health Care, because there are so many different things to understand about home health care, Traci. People don't understand licensing. They don't understand why one organization can't do whatever they need to have done. So we're in this, I call them elements of care. We're in these elements of care, this Avid Home Health Care. Where do you all fit in?
Okay, thanks for having me on first. And I just want to say, I guess it's easiest to explain it by the different types of home care that there are. There's several kinds. There's skilled nursing home care, which is paid for by Medicare and Health Insurance. That only comes after you've been in the hospital, or if you've had an injury, you've had surgery, and then they come to your home. They come for a designated period of time. You have to show progress. They set goals. Medicare just shortened their episode period to, I think, 30 days. Used to be 60 days. So they're going to be on and off service pretty quick. And those kind of services include an RN, a physical therapist, an occupational therapist. They can include a speech therapist, and a home health aide that can help you get showered. But that's all their home health aide will do. and she's limited how long she can come.
Let's go back. You just mentioned something about the 30-60 day. Explain that.
So I worked previously, before I took over Avid, I worked in skilled nursing home care. And what happens is we admit a patient onto services. Say you come home from the hospital, and it can be surgery. It could be something like an exacerbation of your congestive heart failure, anything like that. So you come home from the hospital, and the discharging doctor has sent an order over to the home care agency of your choice to come out and see you. They'll come out and admit you to services. They have to set goals through the Medicare documentation that they provide, and then they have to show progress to those goals. So each discipline actually sets sort of their own sort of treatment plan of how often they're coming, what they're going to accomplish when they're coming. The nurses' jobs are usually to do obvious things like wound care, incisional care, IV antibiotics, Foley catheter care, things like that. But the other thing the nurses do that's really important is teaching. They do a lot of teaching on why you went to the hospital, how to prevent yourself from going back to the hospital.
Okay, but go back. You said something about it reduced the period of time from 60 days to 30 days. What did you? Want you. What exactly did that?
January 1st, it was a new Medicare regulation. January 1st.
But what is that regulation? What does that regulation do? It's important.
It limits the amount of time the home care agency can come and see you.
That's right. That's what I want you to say is that
I'm trying to be nice.
That I know it, but they have cut the time.
Yes, they have.
That
they can come and help you.
Okay, but now let's just shift over to Traci for Debbie Fischer for a minute. Got Traci, Debbie, all these names there.
It's okay.
Let's shift over to Debbie for a minute. You made a note there. Why did you make that note?
Some of the other changes that are happening with Medicare. Another thing is the premium did increase to $144.50. The Medicare premium, it was $134.50 last year, and it did go up about $10, which is a lot for people who are on a limited budgeted income.
Yeah, nothing's free. We have to pay for everything. We have to understand that, but there's so many. Don't quite want to fit the two of you together because this is you have the opportunity here. And I'd like to go back and forth because some of the things that Traci's talked about. Debbie, so far, what Traci? You're with Medi-Health
Insurance. Yes.
Health Insurance. And what is it exactly that Medi-Health Insurance does that ties in with what Traci does?
Well, I work a lot. My primary clients they're senior citizens, and a lot of people are coming out of the hospital, and they do use a skilled nursing facility where sometimes they're by themselves. They don't have a person to lean on, so you need to have someone in skilled nursing to come out there and help them check their bandages, administer any medications, maybe give them a bath. That's a big jump from 60 to 30 because these people need extra help. They're by themselves, and it's scary because if they fall down after a hospital visit, they can be in a lot of trouble after that.
So that's where the non-skilled home care comes in. Because non-skilled home care basically covers all the services that people need outside of the Medicare agency, which is a lot. Some people need simply somebody to come and help them shower safely. Some people just need somebody to be in the house when they shower so that if they fall, somebody's there. Some people need full care. They need diaper changes, incontinence care, to be rolled and changed position. Many of our clients get companion care, which is sort of a service that people will sign up for when they're in the beginning parts of just needing some help. And they may only need help with a few little things. One of the biggest ones I like to talk about to clients is that as a nurse in a skilled nursing agency, I came to know that a lot of senior citizens stop eating healthy as they get older. It's a huge problem. And you combine that with things like congestive heart failure, fluid retention in the legs, around the heart, in the lungs, high blood pressure, strokes. Everything they're eating is packed high with sodium, absolutely packed. And sodium will shoot your blood pressure up faster than you believe. If you don't believe me, check your blood pressure, eat a few potato chips, and then check your blood pressure again in like 2-3 minutes, and you'll be shocked. So, we have this issue, and these are some of the things I learned being in a skilled nursing agency and taking care of patients that I knew that were going to need help beyond when Medicare said we could still come. So what are they going to do? Because if they don't get help, they're going to come back to us. They're going to go back to the hospital. They're going to come back to us. Mm-hmm. So Avid was formed a couple years ago by two friends of mine who were retired ladies in Merritt Island. They took a concept that the three of us really developed that's different than a lot of the other agencies that do the same services. And we've been committed from the beginning to make it very, very custom to each client. Most other agencies have hourly minimums, 3 and 4 hour minimums. They provide services, and some of them provide very good services, but they're in blocks of time, and whether they've completed what they came to do or not, they're going to be there, or they're going to charge you for the 4 hours. So a lot of people don't like, the person, they say, I'm paying them to sit here for 2 hours? I mean, what am I doing? And I found as a nurse that a lot of patients really just needed help with showering, just showering. There was no agency in the county that would come out for just an hour to help somebody shower. And Avid does that. And 3 years later, we still do that. And I'm not sure, but I think we may still be the only one.
So, if you're saying that you don't have a minimum block of service then?
I do not have a minimum block of service. It's custom to each client, and like I talked with Kerry on the TV about, a lot of clients, they don't know when to start services. They don't know if they're ready. Do I need it? I only need help with a couple things. It's probably a good time to get started on services with something like a couple hours a week of companion care. It gets you used to the way things work. And with my agency, we can grow and change as your needs grow, both forward and backwards. If you require more help, we can supply more help.
Do you do all the way up to and including skilled nursing care?
We do not do skilled nursing care. So home health care is split into 2 sections, skilled nursing and non-skilled nursing. And I have a unique advantage because I've worked in both sides of it. So even sometimes we find that doctors don't even understand. They go and they write an order for, say, Health First Home Care to come out and help somebody shower. And it's like, no, that's not how this works. And insurance doesn't pay for that. Some people are able to get VA benefits. There is a program called Aid in Attendance, and we work with a nonprofit organization called American Veteran Care Corporation, and they will help guide veterans through the qualifying process with a simple referral that we can make. But a lot of these vets have benefits that they aren't aware of, sitting in a bucket at the VA, waiting for them to ask for it, basically.
We've been talking about that for 30 years.
And they can access it, and we can help them access it. And they do pay for services. They give them, based on what their needs are, they give them, a certain amount of time each month. And sometimes it's like 87 or 90 hours a month. It's a significant amount of time, and it can increase.
But let's talk for just a minute about what you're talking about. Service. I noticed in the paper that you have out on the internet that your services run from $17 to $23 an hour. Is that still right or not?
No, that's incorrect. I don't know where you got those numbers.
No,
okay.
That's all right. It's
so the way the services work for us, and I don't want to share all of my prices online.
No, I don't expect
but
you to.
the lowest rate for me is $20 an hour, and that's for companion care. And that could include anything like light housekeeping, laundry, meal preparation, cooking. That's the big one for the people who don't eat right. You have somebody come in, cook you a healthy meal, cook you a couple healthy meals, stay a couple hours, pack them away in the fridge so that you have things to grab and heat up that are healthy. That's a big service for people that really is very popular. And, sometimes it's just about they don't have the energy to get to the store, do the meal planning, do the shopping, do the prep, cook it, clean it up, or they don't want to cook for themselves.
But if somebody really did just need help, I can't even think of a case where somebody just needed help with a shower, but you say that they do.
Oh, we've lots of them.
I could think of a couple right now.
We have lots of them.
If somebody just needed help with a shower, how long would it take, you think, to do a shower?
It depends on the clients, and it depends on the employee. Some of my employees get done in less than an hour, but the 1 hour is the minimum that we charge.
Okay, so and how much would it? Well, I don't want to get into cost.
A 1 hour shower is $30 flat.
Okay, all right. So you what you have in is a varying rate scale of the services that you show the people that you go out and talk to. Now, Debbie, with you as Medi-Health Insurance,
yes,
do policies or things that you write for the companies you represent, hearing what Traci is talking about, do you have some of the types of insurance that can work with what she does or not?
Well, some of the Advantage plans do offer transportation or meals after a hospital, but it's limited, maybe 10 meals after a hospital stay. A lot of my clients, though, they're being taken care of from their children. And it is a lot more comfortable to hire someone to give their parent a shower. I mean, it's uncomfortable for everybody.
Yep.
And I just had a call yesterday from someone in tears because they are just exhausted.
Right.
It's a full-time job. It doesn't stop, and they need a break. So Traci's services would absolutely help them.
Yep.
But the companies you represent,
Yes.
are there policies that you can write?
For non-skilled services, I don't think there is.
There is one, and I can't really go over benefit details because of compliance reasons, but there is one that will pay for a couple of hours to help out, like 4 hours.
Okay, all right. Let's be specific. I have long-term health care.
That will pay for it. I was just about to say, the only insurance that will really pay for it is a long-term care policy.
But most don't have that. Yeah.
You don't have that in your whole repertoire?
Medicare does not cover long-term care.
Okay, so then your companies just represent policies or holders that are eligible for Medicare.
Yeah, I represent a number of Medicare Advantage plans, supplements, and the ACA and short-term medical. So if you're in between jobs, I can help you there with medical insurance at about a third of the rate of what the ACA is.
Okay. All right. So Traci's talking about one thing, you're talking about something else, and this is where our medical system, I think this is where we fall through, and we need policies that you can sell that would enable the average person to take out that policy. I know that people couldn't afford what I pay for. I've had long-term health care for my wife and I for years, and when I bought it, there were roughly 120 companies selling it. Today, there are fewer than 20 companies, and the reason for it is that it just was breaking the companies. It couldn't afford the expense because we were living longer, and that's one of the things that we've done. But how does Medi-Health Insurance, how do you help seniors? I guess that's the thing for you to explain.
Well, I help seniors. I've been doing this for about 10 years now. I help seniors find the right plan for them, insurance plan. They're Medicare Advantage plans, so I have to be very compliant. I explain it to them face to face, not on a phone, not on the computer. I'm right in front of them, and I'm a local here, so I know the area. I know many of the doctors. I can try and find a good fit for them based on their needs. And I can explain to them what Medicare, Medicaid, low-income subsidy, and these other programs that they're eligible for, and maybe they don't know that they qualify for Medicaid, and I can help them get approved with my Access Center.
Do you work with senior citizens to help them get Medicaid?
Yes, I do. I have an access center within my company that I use quite often. It's an expedited service, and I get them approved if they fall within the income requirements within 21 days. It's excellent. And it's a phone call, basically. They can call me. I could do a 3-way call. As long as they fill out the paperwork and they fall within the income requirements, I can get them approved and put them on a better plan.
Do you ever work with the volunteers from Shine?
They know me. I think I was listed in their catalog at one point. They know me. I do get some referrals from them. Mm-hmm.
Okay. If you're getting referrals, to me, if you're getting referrals from Shine, then you're doing a good job.
Thank you.
No, I'm serious.
Thank you.
Because I follow this type of thing. The same thing I would say to Traci and Avid. If something goes wrong with somebody you're serving, I can tell you I'd hear about it. Because people do call me, and I know this, and I know there are good companies here in Brevard County. I know there are some companies that provide an average service, which is something that as all many people can afford, but I know there are services that more people could avail themselves of that cost a little bit more, that in the long run would ensure them getting a better care system put in place for them.
Absolutely.
And that's what makes this whole thing different. And you made a comment about Medicare Advantage plans. Because I got one for Tracy, I got one for you.
Okay.
You say you represent primarily Medicare Advantage plans.
And supplements and short-term medical plans. I do a number of different types of medical insurance.
Okay. Tracy, in dealing with Medicare Advantage plans here in Brevard County, do you find that, let's say if a person is coming out of a hospital and they're coming out of maybe one hospital, can they get services through you, or are they sort of encouraged to go with the plan where they're coming out of the hospital?
We can complement. We can work together with skilled nursing services. We complement each other's services very well. I mean, we do services that the skilled nursing agency doesn't do.
Oh, I know that.
Yeah.
I know that.
So we can work together because we're not being paid by insurance. We don't need a doctor's order. We don't need a reason other than a client requesting that they come on service for, a customized list of things to get done.
Let's say if a person came out of the hospital and they were prescribed braces or different types of equipment you'd have to get through, say Brownings, and Brownings didn't carry it, and then they have to send a prescription to another company. Do you get involved with programs like that, or
I do not, unless there seems to be a lot of confusion, and I think I can clear it up. But it's not my business to really get involved in that part.
But I do.
Okay, I figured one of you is going to answer that. Now, how do you get involved in it?
If they're my client, I am a local here, and I was at someone's house this morning submitting a claim for a dental reimbursement. They did not understand the form, so I went out there and I helped them with the form. If they need an extra helping hand, that's what I'm here for. That's my customer service. I get paid by the insurance company to take care of my members, and that's what I do. I have a lot of people come visit me Tuesdays and Thursdays. I'm in a location, 17 East Hibiscus, the Sharing Center. I help people answer questions. I have members there who need help. They need referrals. They're not getting in with their doctor. They want to change their doctor, and I can help do that.
Okay, we're getting close to our mid-show break. I don't think anybody's going to hang up for the second half because there's still more things we're going to touch on the second half of the show. But you're really triggering some thoughts in my mind, because I'm going through this pain management system myself, and I've done it for years. And I I've written so many articles in the newspaper, and okay, I'm getting a signal to wind it up and take our mid-show break, folks. That got me tied up here. So, hey, listen, stay with us. There's some more things I really, really want you to hear from these two ladies on the second part of the show. Stay with us.
And our time is 12:34 on this Wednesday afternoon. It's Wednesday. That always means it's Joe Steckler Day. And here is the host of Helping Seniors of Brevard, once again for the second half of the show, Joe Steckler.
Hi, John. I don't think it's Joe Steckler Day today. I think it's Debbie and Traci Day today. I'm getting beat up. But, you know, that's... doggone it. That's one of the reasons that we do these radio shows, because we all learn. I don't care how long you've been doing this, and I've been doing it, the healthcare business, for over 30 years. I did some of it in my last job in the Navy, and I had 33 nurses that worked for me. I had 3 doctors. I had a semi-hospital. I had an assisted bed floor, and I had 550 clients at it was a Navy retirement home, and Lord, we had all kinds of services and everything, and I'd love to have that sitting right here in Melbourne, where I could fight all the stuff that the commissioners talk about, and they're doing a survey now. They're going to find all the homeless people, and they're going to go out in certain spots in the woods and find some people. But how about all the people that are in their 70s, 80s, and some in their 90s that are living on $600 and $700 a month, have no decent place to live? And if we had more places like Trinity Towers, where there's somebody that only had a $600 income, they're going to pay $250 or $275 for a room and a small kitchenette and a bathroom and have a decent place to live. We don't have that. We just don't have it. And it burns me up when I find that Osceola County, the county commissioners over there, are putting $9 million into a fund to help build affordable housing. And it really twerks me when I find that our legislators take $164 million out of the Sadowski Fund, which is designed to build affordable housing, and put it in the General Revenue Fund to help pay for the doggone governor's budget. And I'm not afraid to say it. It's on the books. It's nothing I'm hiding. You can go on the internet, tap Sadowski Fund, and read it for yourself, folks. You don't have to believe me, and you don't have to believe the internet. But somewhere along the line, someplace, you're going to have to believe somebody that says this is the way it happens. And we have a wonderful medical system, but if we don't have people like Debbie and Traci that will bring these differences in what insurance can really do for you, and you had something on the question that you said to me, Debbie, about what's the difference between calling an 800 number to talk about an insurance program or doing something face-to-face. I just can't imagine anybody calling an 800 number to get a doggone service, and I think it's criminal, but they do it.
They do it. Well, they get you on the phone, and people just agree to things. Sometimes they don't understand what they're agreeing to unless they see it. Some people learn by visual props. Some people learn by listening, but it's good to have someone to have your back with the insurance.
That's extremely important. That's why I until you made yourself known to us, there's just so many things that when you get into senior care business, you get into programs, you understand programs like what Traci does, because there are so many programs like that. Our job is to try to get the companies that really do provide a service that's really needed at a fair price and do help people. The same thing with insurance. I'm all for us getting programs in our directory and getting people to write articles about what is really available on the market that can truly help people. And in the last part of the show, I'd like both of you, Traci, you and you, Debbie, both to, while one's talking, the other regroup a little bit and think about what Avid does that's different from what some of these other organizations do. And then when Traci's thinking about that and talking about Debbie, you think about how some ways you might be able to interact with what Traci is doing that maybe that she doesn't really know. Because I have found one of the things my wife talks to me about is that one of the best things about our radio and TV is we bring different people together that didn't have an idea as to what types of services the other really did, and by talking to each other and talking over the radio or on television, we find different ways that we can assist each other. And one of the things that me, as a private citizen, I have a hard time sometimes with Medicare Advantage plans, because certain Medicare Advantage plans encourage people coming out of their hospitals to use only their services, and where a person has an entirely personal right to request Avid, to request Kindred in Home, to request a number of other skilled services or other type services. And both of you made a comment about prescriptions and what a doctor writes and what they can write, what they can't write. And you just can't take what they're saying for gospel truth all the time. You have to follow up, and you have to ask questions. By my failing to ask a question the first week, I am now in my 6th week of not having a brace for my leg where I can't hardly walk 3 steps without stopping, in extreme pain. And I can't get the doctors and the medical system to work together better to get me in to see them. And if it's happening to me, and I know the system,
it's
Lord,
happening to
what
everywhere.
is happening to so many other people out there?
It's happening to everyone.
Yeah, and that's what I like to get at on our radio shows. So with me taking off my soapbox, who wants to go first?
Go ahead.
Want me to go? Okay.
Go ahead, Traci.
So kind of along the lines that you were saying, I mean, you're frustrated with the medical field. Avid was developed because I was frustrated. I was a frustrated skilled nursing home care nurse. There were no services available that were not a 4 or 3 hour minimum. And my own experience as a nurse, when we would try to set these patients up with the non-skilled services, they would come, they would basically assign blocks of time. They'd say somebody will be here. There never seemed to be a lot of focus on who's coming. Are they going to be a good match? How are they going to know what to do? And then the services themselves were just disappointing. People sat and were on their phone for 3 hours and did an hour of work. People didn't interact with the client. People didn't show up. I mean, I've heard horror stories like you can't even imagine. People coming in, laying down on your couch. Just unbelievable stuff. And I'm the kind of nurse, I mean, I really believe I've done a lot of different things in my career, and I believe that since time has moved on, the medical field has forgotten that they're a customer service industry. We have forgotten that. We're paid the same amount whether we give you good or bad service. That's a problem. That's created a huge problem. Many times we act like, you shouldn't be questioning me. I'm not going to give you all the answers. You're the patient. You deserve all the answers. So through my frustration, that's how Avid basically was developed by these two friends of mine, with the concept that the patient's first. The client is first. We don't need to talk about a lot of extra fluff and extra hours. What do you need? I do, thankfully, because I'm an RN, I do all my own admissions. Maybe someday there'll be a point that I can't do that anymore, but for now, I'm doing it because I like the one-on-one client connection. The clients become connected to me. I get to know them a little bit. As soon as I meet them, I immediately start thinking about who I have employee-wise that will be a good match for them. So things like that are definitely at my advantage. But I just feel like we really needed to take it back to being customized and individualized to each person. cookie cutter services do not fit in medicine
Okay.
anywhere.
All right. Debbie?
Well, there's a big difference between HMOs where you have to get that referral or having a PPO or a supplement. Supplement gives you free range where you can go to anyone that basically takes Medicare, but a lot of people can't afford the $200 extra a month, and then the cost of a drug plan. So they opt for a Medicare Advantage plan. When you do an HMO, you're going to have to get referrals in most cases, and that's going to be another hurdle to jump. A PPO, you can go in and out of network, and your network of doctors is going to be a lot larger than an HMO. Speaking personally, I have had to take some of my family outside of Brevard County just to get the help that we needed, to Orlando, to maybe some of the bigger hospitals.
Say that again.
Well, I had a situation in my family where we were just not getting the help that we needed in Brevard County. Luckily, the member of my family was on a PPO, and we had to step outside of Brevard County to go to the doctor that we wanted to go to. And we got excellent service. I mean, we got what we needed. That we were not getting that from Brevard County. So
you didn't go to Florida Health, did you?
No.
I just wondered because so many people do go to Florida Health because it's a wonderful hospital.
It is.
It really is.
It is.
Mm-hmm.
I had my mitral valve
Replaced there.
done
I had my
yeah.
son there, yes.
Yeah, and it turned out it was they put 2 clips in, and the leakage was almost non-existent once they finished it up. But you don't know me. I've had a stroke, and I had a dissecting ascending and descending aorta.
You shouldn't have survived that.
I know. God kept me here for
There's
a
a reason that you
There's a
survived
reason.
it.
And I think a lot
definitely.
of it is just radio and writing and trying to help people understand that they can't sit back and wait for somebody else to do something. And that's why I feel very strongly about the senior advocacy program that we're going to start over here at the Senior Resource Center. And I hope both of you will think about whether or not you want to be a part of it, because until we get enough agencies that provide the service as well as the people that receive the service, until we get them united and behind a common goal, and it can be done, but it's going to take somebody, some organization to be the spearhead, to drive it and bring the other people together, because you can't put 100 people in a room and accomplish something. You can listen, you can get some ideas about it, but a small group has to put it together and then present what the small group puts together to the majority, and to get them to agree and say, yes, I can support that. And it's not right when you have anywhere between the 7th and 12th oldest county in terms of the number of people over the age of 65, such as we exist in Brevard County, to have seniors taking such a back seat, both for the types of insurance that they can get and the types of care that they can afford to pay for. And until everybody understands that there are ways to make these things work, and we don't have a lot of time left, but I would like to ask just a quick thing, Traci, from you, and Debbie, I want you to comment from the insurance aspect of it. Is there a way that you think that companies like yours could work with the insurance company to develop something that may say that they could reasonably develop a product that would provide for services like yours? Because until we have some way to do that, we're not going to really solve the problem. And both of you ladies know that. You both know that.
Right.
You comment on it, and then Debbie, I want you to comment.
I don't know what the answer is. From what I know, custodial care or non-skilled care has never really been covered by insurance.
It is, though, for one of the plans out there. They're giving just 4 hours, which isn't much.
Yeah, but it's something.
It's something. It's a start.
It's something. And the long-term care policies do a good job of paying for it. But I've also noticed that a lot of people have part of their policy that will pay for skilled nursing care, but that care doesn't exist except through Medicare agencies now.
That's true.
So where you have a policy that says an RN, you have RN services for 8 hours a week, doesn't exist because that care is not delivered that way anymore. So people get frustrated why I paid for this policy. Well, the policy was written in a time that that service wasn't covered by Medicare, and now it is. So it's a little confusing, but Avid, my rates are very low. I'm licensed, bonded, and insured to protect my clients, and I believe in giving them only what they need. I'm not giving them anything else. So that's a way that we try really hard to make it affordable, but to give them quality care still at an affordable cost.
Okay, Debbie, now, as an insurance agency and representing companies and everything, you've heard what Traci's said this morning.
Mm-hmm.
How can Debbie Fischer have people that are listening to this radio show contact you, and how can you help people understand maybe there are some ways that maybe Traci doesn't know about, that you know about, Debbie, that could possibly have them avail themselves of services like Traci offers?
Well, it's kind of difficult because the Medicare Advantage plans, they have a contract with Medicare, so we have to follow their guidelines unless they put in a couple extra benefits like the dental, vision, or custodial care. So we're really at the mercy of the insurance companies.
Yeah. Custodial care is really the problem, isn't it?
It is. That's where the
problem.
big need is.
And you both know. You both know that. I know it too. And it's just like when you talk about something like you're talking about something on a radio show that's so important to people. But still, having said all that, there are people that need the services that you offer, Debbie.
Mm-hmm.
Conversely, there are people that need to understand or better understand what it is that you really do, Debbie, with representing people for helping with Medicaid coverage, with helping with long-term care that's very, very difficult to get nowadays. But there are ways. And I've been told that there's some new type annuity policies coming out that will deal with long-term care. And I don't know if you're familiar with those or not.
I don't really focus on annuities.
Pardon?
I don't focus on annuities or long-term care at this time.
Okay. But there are things out there, of course, and a way we find this out, Traci and Debbie, is to ask a question. And if somebody's in the home health care business or the insurance business, they can't sit down in a room like the three of us are here today and talking about something. It could be very easy for the two of you to step on each other's toes. Very easy. I mean, no, I know that you're not saying that, but I have had people that are in the home health care business so protective of what they do that they're not willing to listen to what somebody else says. Can you have something you want to say, Debbie?
Well,
Trace?
I mean, I think I was supposed to be on another radio show with you, and it was with someone who was very similar services.
I understand, yes.
And I was worried about stepping on toes. I was. I mean, I know that there's a lot of agencies out there that are doing a good job at giving non-skilled care. I believe we're doing it differently. I believe we're doing it way more client-oriented, way more customer service-oriented, and that's what people need. It's just, I joke and say we're the wave of change in home care. We're trying to change the way this care is delivered because it needs to change.
I agree 100%, and that's why we have so many different. It's a delight to me that we do have people in the county. You're a very avid believer in the services you do. The lady that does this other is the same with her people, and she's very, very conscientious about what she does. And as long as we can find people that are willing to do things the right way, there is more than enough room for the good agencies. My goodness, we have close to 700,000 people in this county right now. There are so many people out there crying for home health care right now as we're doing the show. Mm-hmm. There are so many people crying, Debbie, to understand that there are ways that they can get insurance and they can pay for it, and they don't understand it.
Yep. Mm-hmm.
And that's right. That's just a I could write and roughly 79,000 copies of the Hometown News get printed for Brevard County. Mm-hmm. Seniors are roughly over 300,000 right now in Brevard County. I know for certain there are over 250,000. And we're not reaching but a small we're reaching roughly a sixth of the people in Brevard County. And then how many of the people read the paper and read my articles in there? I know a lot of them do, but a lot don't. And Florida Day doesn't have this in their paper anymore. So we're down to a radio show, a TV show, Senior Scene magazine, where we have both of you will have columns in, and we'll have columns in our newsletter, and that column will be read by thousands of people. I can assure you that, because I know that I personally have had calls on our programs from New York, Illinois, California, Texas, Louisiana, Indiana, and there are some other states. But those I can tell you for sure that I've had people call me and ask me about something. I say, how in the world did you find out about us? Oh, I listened to your website. I went on there and I listened to the radio shows, and I had one call contact. We wanted to talk to Barbara McIntyre from Reverse Mortgage, because they felt that she did a better job than anybody else explaining what a reverse mortgage could really do for somebody. So when I have people that are guests on our radio show that talk about this, and right now my wife whacked me on the arm, and I'm looking at Kerry over, and he's looking over the top of his glasses at his computer. Did you have something you wanted to say? Go ahead, step up there and take that mic there. Okay.
No, I'm just in here for the to remind everybody about a couple of events that are coming up that you do not want to miss. I'm going to give you a half a second to grab a piece of paper and a pencil and jot these down. The first is tomorrow morning. Look for Helping Seniors. We're going to have the Helping Seniors Camaro out at the Senior Expo that's going on at the Wickham Park Community Center. That's tomorrow from 10 a.m. to 1 p.m. Dennis Mannion is going to be kind enough to go over there and fetch that car and take that out. That will be the first public appearance we've had of the Helping Seniors Camaro, which is one of 4 cars that the winner can choose from in the Helping Seniors car raffle. And, folks, as you know, that's our major fundraiser. The other thing that I wanted to remind us about is the community information series there at the Senior Resource Center of Brevard, which is where our Helping Seniors offices are located, and also the we're there in the Nautilus Ballroom on the second Wednesday of February. We have Eyes, Ears, and Speech. So we're going to have doctors, eye surgeons come in. We have board-certified audiologists coming in, and we have a speech therapist coming in. So you don't want to miss that, 10 a.m., and it's the February the 13th, I think. It's the second Wednesday. So that's what I have to add.
Okay. I want to give our phone number. Our phone number for our office is area code 321-473-7770. Tracy, give your phone number.
321-392-3400.
Okay, Debbie?
321-258-1213.
Tracy, again, slower, see if you remember.
321-392-3400. 3,400.
I got her to think about something. Okay, do you one more time?
Okay, 321-258-1213.
Folks, I hope you've enjoyed the show today, because it's a show that's designed to bring you information and help you become better educated about the resources that are available in Brevard County And you can call our office at 473-7770 to find out how to contact both Traci and Debbie. And we can give you their phone numbers and tell you how to call them. But I thank you for listening today. We'll see you next week on the next edition of Helping Seniors. And Bill Johnson will be here with another person. And Bill is always very good on the subject of estate planning and everything else. And I know Debbie or Traci will do a show with him in the future because there's something she wants to talk about with him, and we'll do it sometime in the future. So have a great weekend, and I'll see you next week.